Good evening. First of all, let me thank you so much for allowing me to visit with you in this manner. I regret that I am not able to be there in person, but as all of you know, we do have an extended session taking place in Washington, and we're trying to get a lot of very important work done before we come home for the holidays. But I'm sure that in this season of giving, all of us will give thanks for where we are today, and hopefully through prayers and hard work, we'll get to where we need to be in the not too distant future, both as a nation and as a state. I want to thank those of you who have been working throughout the state of South Carolina under the auspices of the South Carolina Primary Care Association. The hard work that you have done to make community health care centers what they are today. Not just places where people go to get primary care, but also places that have created a new economy throughout the state, especially in rural communities. And it's because of your efforts and of your successes that I was very, very comfortable in working hard to insist that when we do healthcare reform, that we give a very significant role to community health centers. Some people thought that it was not to be. But I'm proud to say to you that the bill that we passed in the House of Representatives has a very strong community health care centers component to it. I am hopeful that the Senate, by the time it finishes its work, will join us in that effort. But irrespective of what may be produced by the Senate, the fact of the matter is, because it is in the House bill, it will be under consideration when these two bills get to conference, which I hope will be before the holiday season is over. We were able to do what we did because of you. Many of you who have worked long and hard to make community health centers what they are today. The fact of the matter is, we ought not have a healthcare system that provides primary care only in the emergency rooms for people who are without health insurance. We ought to have primary care provided in communities where people can receive the attention that they need, and also in a very economical way. Getting primary care in emergency rooms is the most expensive way to deliver health care, and we believe much less effective than doing it in the community health care centers. And so I want to thank you all for all that you've done. Thank you for helping to prepare me to make the arguments that we were successful in making. And thanks to your association and each one of the centers that helped to make up the association. Thank you for all that you do. Thank you for what I know you will continue to do. And I hope that in the not too distant future, we will have a healthcare reform bill that will complement your work and incorporate the efforts that you put forth and hopefully more effectively and more economically deliver health care throughout our communities. So in this holiday season, I wish each and every one of you safe travels and lovely celebrations. Thank you and Godspeed.